We come into the General Assembly with some background and some knowledge. For me, it was a healthy, long career in the insurance business and employee benefit side, so the healthcare side. But we come in thinking that we've got a singular clue, and we find out that we really don't. And really, it's being able to have you come to our offices and reach out to us in the district and explain things and put things in perspective that really give us the opportunity to take our knowledge that we have and translate it into something useful that becomes hopefully good public policy. And that's what you guys do. And for that, I'll be forever grateful for the learning lessons that I've received since I've been down here. I am term limited. And so as disappointing as that is, it's the will of Ohio that we have term limits in this state. So we take that in stride. A couple things that we have lessons learned with term limits for us in the House, particularly right now, has been our leadership team. Speaker Rosenberger found himself in a position where virtually everyone in his team is gone at the end of this year, absent one who will most likely, we perceive, run for statewide position and potentially make a transition next year. So I worked with the speaker and brought along another person from the leadership team, and we agreed to step down to bring on two new faces so that when the next leadership transfer happens, that we're not looking at 5 out of 6, that we're looking at a smaller number, giving the incoming freshmen current faces to look at. You sit on boards. Anytime you have a large shift in a board, that is disruptive to the process and to the health of the board. So my prize for that was, not my prize, but with Representative Hackett going over to the Senate, that created an opening in insurance. And I said, well, Speaker, I've never chaired a committee before. I've always been in leadership. So I'm more than happy to make that slide over to chair insurance. It's a wheelhouse of mine anyways. So I'm having a good time over there learning deeper on some of these pieces of legislation that I even thought I needed to go into. So that's just kind of a little quick, really it started out as a thank you, I guess, to you for all your educational help. Although I could probably thank a dozen or more people here, I can't tell you how impactful Nick and Carrie have been to my ability to learn and my ability to grasp in the short amount of time that we have in order to learn things. Their ability to both provide stories which give context, but drill down into meaningful fact points that allow you to feel comfortable with doing legislation and changing public policy has been critically important to our success, and I'm sure Shannon probably feels the same way. There's nobody that develops what I call a small but deep sandbox that doesn't do it without the help of advocates that do that work. So thank you so very much. With that, I just really want to quickly touch on a piece of legislation that I'm working on, and thank Bill Byers for bringing it to me, along with OCHA for bringing me the House Bill 493, which will look at the abuse reporting system and looking to change that to bring it up into today's time frame that recognizes that we do things in a collaborative manner and that reporting should happen in a collaborative manner also, and the best way to protect both the child in both ways from abuse and also the ability to potentially protect the opportunity for the family to remain whole is to do the best that we can with the reporting system and the following up system that revolves around the incident that caused the crisis to occur. Nick is especially going to be happy that we're doing this because as he runs his kids in and out of the emergency room, he's going to get the same look that I got when I ran my kids in and out of the emergency room, which was like, again? Yes, they dove off the bed onto the stairs. It can actually happen. And so we need to make sure that we're doing that appropriately. We are working very diligently to fast track this. This off-budget session, it's like this is a warm-up to a lame duck session right now. We are in sprint form right now because we are really trying to get a lot accomplished. Lame duck is going to be quick and intense, and the finish up to before the summer break is looking like it's going to be the same. So we are working through a lot of bills. One of the things that Nick touched on briefly in the introduction that I want to spend just a moment on is JMOC. So Shannon and I and Dave Burke and probably maybe one or two other people, continuously battle our caucus with this idea that nobody wants to learn about Medicaid. I don't understand it. It's exciting to me, but nevertheless, they don't want to learn it. And I keep trying to explain to them that I get the fact that they think education is the most important thing in the state, but almost 50% of our budget is medication. And if you really want to be in fact impactful to public policy, and you really want to make sure that those folks you are trying to educate are capable to learn, then you better figure out the Medicaid component of it and the healthcare component of it first, because nobody's learning if they're not healthy enough to get there. And so, you know, I try to instill that in them. JMOC is one of the tools that, thank you to Senator David Burke, who took up the mantra of what we had been talking about for years and actually put it to paper and got it passed. So JMOC is a joint legislative, so it's 5 representatives, 5 senators, with splits R's and D's, so minority party, majority party is represented. But the key to success on JMOC is that we've got an executive director that actually is knowledgeable, understanding, and has a history and experience in the healthcare Medicaid space. She has someone that works along with her, and then we have the ability to hire an actuary. This becomes very important. One of the things that we passed in the last budget said that Medicaid shall not go over 3% growth. Well, I can tell you, I can probably give you, and as Shannon can also, a list of the top dozen bills we have passed that are going to push that over 3% growth. And folks, that's our pie, is 3% growth. Current plus 3% growth. So if we are increasing through legislation a sliver, it decreases the balance of that pie. I mean, that's not rocket science, that's basic math, right? And there is a disconnect of understanding on how that math works. So when you talk to your folks today, when you talk to the legislators or the assistants that are in those offices, make sure you talk about how important it is to be looking at Medicaid, holistically and including all pieces and parts of what it means. This is going to be very critical for us in the upcoming budget. We do not dynamically score our budgets. So I cannot pass a piece of legislation today that I know I'm going to see a financial benefit in 4 years or 6 years or 8 years, because the people that are voting on it aren't going to be there in 4 years or 6 years or 8 years. They're there today. Different from your own businesses where you have the ability to say, we're going to implement this, which is going to be a cost, but it's got a long-term benefit, so I can do that cost-benefit analysis and see an outcome that's appropriate, not only from health outcomes but from financial. And we don't have that. And so as you talk today, keep that in mind. I'm sure you've got talking points that have been well prepared, but keep that in your thought also as we go through some of this process. If you find we have caucus today at 12:30, we have session at 1:30. With any amount of luck, it will be quick. I doubt it, but we can always hope. And so it is highly likely that you will be introduced to our legislative aides. Take this as a teachable moment with them. You may be the very first person that they have ever met from a children's hospital. They may not even know that the state of Ohio has a different children's hospital versus kind of the all other. They may not even be aware of that. So look at that as a perfect teachable opportunity, and you may actually find their mind more expandable than some of ours, and take that as an opportunity to teach. What they learn, we ultimately benefit from. So when you find the staffer, don't go, oh, I came 2.5 hours to get a staffer. You may have scored a better meeting than with us. So not that we aren't all marvelous, but nevertheless. With that, I think, Nick, you wanted me just to kind of open it up for a couple questions. I'm happy to be pointed in whatever direction somebody wants me to be pointed in. You guys are easy. Then I'll just say thank you so very much and turn it over to Shannon. As Shannon is coming up, I'll tell you that my redshirt freshman year and my freshman year, I couldn't have asked for a better mentor on these issues than Shannon Jones, not only from a standpoint of our commonality of both being women in a predominantly male world, but being relatively, I think we're considered strong women. Yes. We might be. Yes. Maybe strong women, but just the knowledge base that she's been able to afford me and the backbone that she's been able to afford me, I very much appreciate that.
Sweet. You're gonna miss.
I'm gonna call you up, Mr. Crash.
Yeah. Right. Thank you so much, Barbara. I certainly feel the same sort of camaraderie with you, and have enjoyed serving together in both chambers. Term limits is really a tough thing, and while it's the will of the voters, and you don't spend much time crying over spilt milk, as they say. I think that as it relates to the issues that impact women and children and our most vulnerable, I think term limits has not been all it's cracked up to be. And so while having the privilege of serving my constituents in this state for nearly a decade now, I can say that this has been the greatest honor of my professional life. I wish it wasn't ending this way, because I've really enjoyed advocating with you all on those things that, frankly, outside of this room, not many people care about, but is so central to, I think, who we are as community and who we are as the state of Ohio, and really who we are as, humanity. And so that I'm hopeful that whether it's through JMOC or some of the other things out there, and some of your advocacy efforts, we will invigorate a new group of legislators who are prepared and willing to stand for a whole lot of people who can't stand for themselves. And so that is my hope as I look on now, for me, 237 days. So I have 237 days left in the General Assembly. And so those of you who work around Cap Square, I see Jim smirking back there, because they have heard me have the daily countdown. In every speech I give now, I talk about how many days I have left. And it's not because I am sort of the good riddance. Good riddance. I only have 237 days left, although there are moments when I feel that way. Caucuses are sometimes that. But it's really, for me, an opportunity to be incredibly mindful about how limited my time is here, and thus how important it is for me to focus my time on the things that I really want to get accomplished. And that's what I want to talk to you for a few minutes about, and hopefully get some questions or some feedback for you on it. And so I've obviously spent a lot of time, perhaps much to some chagrin, on the issue of infant mortality. And you all know the data around this, and you know how desperate we are to do something about it. And what always stuns me are a couple of things. And again, I know you know this, but I feel convicted to say it every chance I get. Because we in the States are spending $55 billion, with a B, billion dollars, on health care. $55 billion in our budget. That's what we're currently going to spend for some of the worst health outcomes in the country and the world. Notwithstanding the fantastic institutions that you all represent, but you all know that in the zip codes where your very institutions are located have some of the worst rates of infant mortality in this state, in this nation. And so while we're spending $55 billion in the clinical setting, we have to really come to grips with the fact that that's only a small part of what constitutes our health. And we really have to be brave enough to challenge our systems and challenge our thinking and challenging our funding to get after those social determinants of health. They are inextricably connected, and if we don't own up to that, we're never going to move these numbers. Never, ever. It doesn't matter how good things are in your facilities. And so why is that important? Why is that important? Well, yes, we're 45th, depending on what study of the day you want to look at, 45th in the nation in infant mortality. In fact, that makes us worse than places like Cuba. But when you look at the racial inequality in those numbers, the racial disparity in those numbers, it is immoral. That if you are a black baby in the state of Ohio, you have a 2.5 greater chance of dying before your first birthday than a white baby. Now, I know you know this, and I know you all work really hard to try to do something about it, but I feel convicted to repeat it because we have to own it, which means we have to do something about it. Every day we have to do something about it. Big, bold, unafraid. We have to do it. And so while I think a lot of us who work in this space and we put together these reports and we pour our heart and soul and our passion into it, and the outcome is just this wonderful report, we feel the need to share it with you. And so I'm sharing it with you because I'm sure you'll have nothing better to do but to read it from cover to cover. But I recognize, as proud as I am of this document, because it is getting some really good national level support about the first time we're really starting to talk about social determinants and connecting the healthcare system with them in a meaningful way. I'm proud of that. It's only as good as the people who are willing to put their money and their time and their leadership behind the recommendations to do something about it. And so while I feel great about this, and we can talk about some of the things that are in it, this is only the beginning. And if I mention to you that I have 236 days left, I intend to spend every one of them bugging you to make sure that we do it and do it right and do it today. That's my ask of you. Or you can try to wait me out for 236 days. But people like Nick and Charlie and Vicky and others know, good luck. But I'll let you all decide that. So what is in this report? So I'll just mention a couple of things, and then I'm happy to answer any questions or criticisms or take some feedback. So obviously, we all know that who've been active in child health that place matters. So we've already decided as a state that where one lives, that is a leading, social determinant of our health, is really important. And so we're mapping zip codes, and we know where the hot spots are. So we have a different understanding of it. Well, now we have to lay over that, how are we allocating resources in those folks, in those areas to reach those folks. So, we're talking about best and promising practices out there to make these connections. So in the areas of, spacing and sleep, that's not changed. We know more information about what's really working, and now we have to sort of really lean in to do some of the systems changes to scale these things. And so, this is where the state really has to take a leadership role, because we've invested, innovation dollars here and there, call them this grant, that grant, the other grant. You've all applied for them. And we are establishing best practices or promising practice or evidence-based practice on some of these things. And so now we don't need to invent the wheel, although I continue to be supportive of new and innovative ways to challenge the system and tackle the problem. But what we really need to do is challenge the system with the practices that we have to get it to scale and get it to the people who need it the most. And so there's a lot of conversation, a lot of recommendations, not just law recommendations, but administrative recommendations and local community recommendations to do just that. I am a big fan of the hub model, for example, and Heidi and I had to talk briefly before we got started about the work in Cleveland that's happening, that I'm really excited that Cleveland's now in the game. Cincinnati's been there for a while, and then Columbus, and now Cleveland. That's fantastic. And so there's a lot of, good practices out there that they're going to be investing in. But at the end of the day, I said to Heidi, so what are we doing to sustain this, to challenge the system, to get these really great practices to the people who need them the most. And so I think the hub model, and there's a lot of information on the hub model and how we can support the expansion of the hub model and how the state can use its leverage with managed care companies to insist on building capacity and really, getting it to the women and vulnerable children who need it the most. Not to mention the fact it's a pay-for-performance model. That's where we're going, so let's accelerate that. The final thing that I would mention, I'm going to actually mention two things. The final kind of thing that I think we can get done yet this year has to do with the social determinants of health. And the commission felt very, very strongly that although we didn't understand and we can't comprehend how to get our arms around the social determinants of health, and what we didn't want to do is reorganize a 4,000-page budget document in a different way. That doesn't really tell us anything. How could we start to, address this issue? So the commission took on the issue of housing, and we're actively working on a project in housing. But one of the recommendations from the commission, and this is one that I'm really excited about and I feel the most proud about as someone who led this commission, is it's for the first time we're acknowledging that we have to have serious stakeholder conversation about this. And we are, in the legislation that will come forward, it will be requiring, hiring of professional stakeholder facilitation under the Office of Health Transformation to pick off 3 of those social determinants of health. Not in any particular order, that one's more important than the other. We know they're all important, but we've got to find a systematic way to start to tackle them. And I'm really proud that the commission was brave enough to put forward those recommendations, and they've got my support to make sure that we implement them, along with real cultural competency conversations. That is something that we are desperately missing in our provider world. Certainly there are pockets of places where people do it particularly well, but across the system not so much, and that's the kind of system change that we really need if we're gonna move the dial. Finally, let me just talk about something that I don't think we're going to see that's in the commission report, but again, with 236 days left, 37 days left, I really feel under conviction to talk about this, and that is the issue of smoking. So I've been given the opportunity to speak with my colleagues from President Faber about passing this legislation. And I've been really encouraged by the Senate President, and I'm grateful for his leadership. It became clear to me, though, in talking with my colleagues, that there was very little support on what the commission was putting forward on tobacco. And I see Belinda nodding her head because for basically 10 years that I've been here, I've been trying to get the General Assembly to wake up and get over the lies of big tobacco and do something about our kids' health. But since I can't get that done, I hope that you all will continue to be that voice in the next 236 days after I'm gone. Because while I'm disappointed about it, because the single biggest thing we can do to not only improve our infant mortality rate, the single biggest thing we can do with the most impact, the single biggest, not just infant mortality, but any of the other health measures where we are failing on, is smoking cessation. Period. Nothing else comes even close. Nothing else comes even close. And so when I talk to my colleagues about this, I'm like, okay, so we don't want to raise the tobacco taxes because we want low-income people to have easy access to cigarettes. And we're paying for it. Because we have nearly 3 million people on Medicaid, and the direct costs associated with tobacco use just for those on Medicaid, I'm not talking about private insurance, $600 per enrollee a year, direct costs. So when we talk about this 3% cost cap that my colleagues were insistent that we put in to law to control the cost of the growth of Medicaid, then ask them why they refuse to deal with the increasing rate of tobacco use. 25% of our state smokes, 50% of our Medicaid population smokes. If we were brave enough to do something about this, we would really start to turn things around. And so I will get off my soapbox now, because I don't, as frustrated as I am by that, and as eager as I am that you will continue to talk about this, because it is so important in any health measure. I can't underscore enough how grateful I am, though, for the support of my colleagues for a lot that's good about this bill. And so with the support of the Senate President, you're going to see a bill in the Senate next week. And I can hope, I really hope that I can count on your engagement in the process. That is going to be quick. And I hope that I can count on your enthusiastic support. If not for, on every I dot and T cross, you come prepared with what the solution is. And so I understand how complicated this business is, but I'm sort of out of patience and out of time. So those who want to come and be a part of the solution, I welcome you. I encourage you to be a part of it. And I'm eager for us together to get this bill done and really start to change the outcome. So thank you for allowing me to be a crazy woman, but I'm like desperately holding on to the microphone. 236 more days. But I'm happy to answer any questions that you might have. You guys really aren't that, Yes, Michael.
Senator Jen, so I think what we all really want to know and make sure of is on day 237, you stay committed to children and be engaged, and we really appreciate all of your leadership. And I think, not having had a chance to read your commission report here in detail, as you know, I think we all share this recognition of the import of social determinants on children's health and infant mortality. And I think my one quick observation would be, as we go toward implementation, both at the state level and in the local level, we think about more cross-sector stakeholder representation than just sort of the healthcare space.
Yep.
We need business leadership, we need government leadership, and I think educationally, we need everybody in on this. We got to think about how we make sure that happens.
Yeah, I really value that feedback, and I hear you, and I couldn't agree with you more, which is why I think the part of the legislation that's going to start demanding conversations from an education perspective, from a transportation perspective, from a housing perspective, that includes our partners in healthcare, but are through the filter of whatever social determinant it is so incredibly important. I'd also add, the other thing that's really important is that we hold ourselves accountable in a real and transparent way to those things. And so I think being really clear about what we're measuring in all of those areas and being transparent about it and holding ourselves, to that standard consistently, even when it gets tough to do, is really, really important at the local and at the state level. We've got to be willing to be honest about how we are assigning resources to things and what we're getting in return for it. So I appreciate your point. Anything else? Okay, so I take that as yes.
Yeah, so if I could get Senator Jones, Representative Sears, come up real quick. Members of the OCHA board, if you come up real quick, we're going to present each of them with a Lifetime Achievement Award. As we talked about transitions, the turnover, one of the real bright spots from the Children's Hospital perspective on issues affecting healthcare has been Dr. Stephen Huffman. I did not know this gentleman very well prior to the speaker naming me. I'm not sure what I did to win that award, but the Ohio House Representatives Medical Marijuana Task Force. But I got to know Dr. Huffman a little bit. He's been caring for patients his whole life. He's passionate. He's data driven. He's common sensed. And I think one of the hallmarks of what I consider to be an effective legislator is anyone who doesn't have to do this job and they made a sacrifice for their family and their career to come serve Ohioans in their district. And I think this gentleman is certainly one of those. So, Dr. Huffman, the floor is yours, sir.
I always tend to be brief, but Senator Jones, she says I'm a crazy woman. I don't see you as a crazy woman. I see you're very passionate and passionate about your cause. And I think that all of us here in the General Assembly needs to be passionate about it. And I do appreciate your leadership. The things that, and I quote you all the time. I say, but I'm embarrassed. Whatever we are, 47th in outcomes or anything, and we need to fix that. And we're not going to fix it overnight. We need to have, the common sense things that she was talking about, and move the bar one step at a time to get over that. So I do appreciate her passion, and you guys, especially in the last 3 weeks, have a lot of conversations about medical marijuana. So, but I'll make it brief and towards the children. I really do think House Bill 523 was passed yesterday out of the House. I think it's very common sense. I think it's a very good balance between what's good for the patients and what's good for the citizens of Ohio. I think it will give people an alternative to what may be the ballot initiative in November. And people will look at it and say, I believe that House Bill 523 is good for the people of Ohio. And it'll be that alternative. So we'll have to see. You guys are very represented with Nick on the task force and ask very good questions. And you see these mothers. The one lady had 300 seizures a day. The child had 300 seizures a day, and is in a research study at Nationwide Children's on Epidiolex. And the mother says she only has 5 seizures a day, and the quality of life of that child is so much more. I just think that we need to continue to do the research. At Nationwide Children, and also they're doing it at University of Cincinnati, of what it can do, and it just gives these people an opportunity. In the bill, there'll be no TV or radio advertising, and it cannot be attractive to children. I'm sure we were all very offended by Responsible Ohio to have a mascot like that. It was just, to me, that is just to appeal to children. So we need better outcomes. The same bill that Senator Jones had on e-cigarettes, I think, was resolved with the FDA decision last week to put it in child-proof containers. We talk a lot here in Columbus and in Washington about common sense, and sometimes it just doesn't get done. To me, that was the most common sense thing, to just, you could take 5 cc's and have an overdose in a child. Why can how you cannot do something like that? Another issue that people don't think of is graduate education in the state of Ohio. The budget, the governor chose to take out $25 million out of the budget last year for graduate medical education, and I find that interesting in the sense that I think the world of the governor. I think he's done a wonderful job, but everything has been about jobs, about employment and the right people, and what more? Maybe I'm biased, but what more of an educated workforce do you want besides training physicians to stay in the state of Ohio? And people, study after study shows that a physician will practice within 50 miles of where he ends his education. That means where he finishes his fellowship or his residency. And so we need to continue to fund, many hospitals, not just children's hospitals, here in the state of Ohio have unfunded residency positions because their community has a need. Especially, there's a huge need in the state of Ohio for pediatric specialists. Cardiology, urology, neurology. It's very difficult to find and recruit those people to your hospitals. And we need to have a better medical education system to get those people to the state of Ohio and keep them here, because those are the if it's all about jobs, those are the jobs and people that we want to keep. The other thing I learned early on in the General Assembly is that hospitals have more issues than medicine. Hospitals are one of the biggest consumers of energy in the state of Ohio. They're one of the biggest concerns about human resources and the people that they work for, and also for the workforce to train the nurses, the physical therapists, and everything else. So there's big needs in the hospital systems. I have greatly, and like I said, 2 years ago, I was running for office, and we were at a candidates forum, and someone says, "You're just running for the money, aren't you?" And I said, "Well, I practice emergency medicine, and I still do. Tonight, I'm going to work all night in the emergency room up in Putnam County." So, I think that is a problem I've caused for myself. Next year, I'll have. I had 4 kids in less than 3 years. Next year will be the first year that all 4 of them will be in college together, and so that will that'll keep me working in the emergency room for a long time. Because so I'll have one at Xavier, and then my next I have one at Notre Dame right now, and my twins that are seniors will join them at Notre Dame. So it'll be a challenge for us the next couple of years, and then I have an 8th grader that will stay home with his be the baby at home. So I've greatly enjoyed my 18 months. There's challenges all the time, because in medicine, especially in emergency medicine, you quickly identify the problem, you identify how to fix it, and you go do it. And Senator Jones, you'll say that doesn't happen around here very often at all, doesn't. That it's hard to agree on a problem, and then it's hard to agree on how to fix it or how much to fix it, and go do it. But especially with infant mortality, we need to all work on that for everybody here in the state of Ohio. So. I appreciate your time, and I'll take any questions if there's anything. I'm not sure what your agenda is, but I'm happy to answer anything. Yes, ma'am.
This is more of a comment.
Sure.
I'm from Cincinnati Children's, and one of the program directors for our pediatric residency, and I really applaud you being an advocate for GME. Many of our residents, including myself, when I came here, are not from Ohio, and I think it's really important to really train the best and the brightest. We have wonderful children's hospitals in the state, and I know at our residency, most of our residents choose to stay here to train for fellowships, provide primary care to our very under-resourced patient population. So I really applaud your stance on this, and I hope it becomes a little clearer.
Yeah, and most people outside of medicine think, oh, you go to medical school at Ohio State, you're going to stay in Ohio and practice medicine. There's a good chance you do. But the true determinant is where you do your residency. So if we don't have viable residency programs throughout the state of Ohio, people will go to Michigan or Chicago and do their final, their residency, and that greatly increases the chances that they will do that. So I appreciate your comments, and my oldest daughter will be doing research at Cincinnati Children's this summer, as she has done this past school year. So, any other questions?
Set a time frame for House Bill 523?
523. The goal, the plan, is to pass it and signed by Memorial Day this year. So today I had sponsored testimony in the Senate. Senator Burke and Yuko are very happy with the product. They have some, as they say, minor things that they would consider changing. But we've been in consultation with the governor's office, and I'm confident that he'll be happy with the product that he gets sometime at the end of May.
You've been generous with your time. I know he's got to get back to the caucus. Thank you, Dr. Hoffman.